Alright guys, let me just put this in a better camera view. Alright, let me just kind of recant over some of the things that that I was talking about earlier about dating and with health disorders. I just want to recant really quick because I made a long video. You can watch the video. I might put a link down to my YouTube, actually my Facebook. And so basically guys, what I'm getting at is, as far as dating with any health disorders, be it anxiety, OCD, panic attacks, all those areas, physical health disorders that you may have, that you're very insecure about. Basically, what I was getting at in that long 20-minute video, I was like 20 minutes, realistically is this: don't have so much self-doubt. Okay. What I mean by that is, don't self-doubt yourself. A lot of people do that psychologically. In the other video, I used a baseball example of minor leagues into major leagues. And basically that's a good example. But what I mean is I'm going to recant this. What I mean by the whole, let's say if you have anxiety or you're bipolar, or let's just say you have a testosterone deficiencies. You're a male. You have testosterone replacement therapy. Let's just say you were through a major car accident and lost some parts of your organs. Maybe there's hereditary things. I can't cover the whole spectrum. But what I'm trying to say is if basically is this: if a girl comes walking up to me, right, or let's minus that, check that. If you see a girl that walks past and a group of guys go, "Hey, she's got a nice rack," right? Girls. Guy walks by, one of your girlfriends points out, "Hey, that guy's got nice arms. That guy's got a nice butt over there." You're going to look. And that's what I'm trying to say when you have health disorders, is sometimes you look for the biggest ways to convey what's going on with you, what's going wrong with you. But the thing is, if the first thing you do is point it out, like the butt or the rack on a woman or a guy's arms, right? Then that's the first thing that they're going to pay attention to. And they're not going to pay attention to your personality or your looks, quite frankly. Right? They're going to pay attention to your disorder, just like somebody would the rack. You're not telling me if you're out with a group of guys, and you're like, "Hey, check out the rack on that girl." No. And then you're like, "Hey, girls," you're out with a group of women, right? And you can even be married and be like, look at the butt on that guy. Look at that guy's arms. You're gonna look, right? That's the first thing you're gonna notice. Not his personality, not his looks. Looks and physique are two different ball games, right? Looks and attractiveness are different. So basically, what I was trying to tell you is, in my opinion, give your problems in small dosages. Don't just come out and go, "Hey, if you feel comfortable doing that, go right ahead." But I think the person needs to get to know your personality, and don't feel bad for doing that. And also too, what I want to choreograph is a self-doubt. A lot of people self-doubt themselves with anxiety disorder. They're too scared that they're going to have a panic attack. People with OCD, I've seen it control their lives. It's one thing to say, "Oh, I'm going to move this over here, move that over here. I'm going to count to a certain number. I'm going to skip certain steps." Okay, that's but when it consumes your life, it's different. What I mean by self-doubt is you just having that self-doubt, and that's what's called self-doubt. It's right in the word. You doubt yourself. If you're already shooting yourself down, then you're never going to make it in the first place, right? If say right now, as I'm making this video, on my face, Reggie Bush has a knee injury. He's a running back. If he said, "You know what? Oh my God, this knee injury, it hurts really bad. Forget it. I don't want to get an MRI. I don't want to. He's not gonna come back. Psychologically, he's gonna be damaged, right? Even though there's only a slight sprain, and I hope he comes back for my fantasy team, but it's a slight sprain. He's not gonna come back. So what I'm trying to say is, you get the self-doubt, right? Get rid of it. And these people, guys, maybe somebody's been through an auto accident. Maybe you've had a part of an organ removed. Maybe you've had a minor stroke. You are a survivor. You are a survivor. Quit having the self-doubt. And I'm going to say this again, like I did in the other video. I'm going to go right into the camera, right? I'm going to look. I don't know how it's going to come out, but you're a survivor. understand that, internalize it. All right. The other point that I was getting about is the 3 areas. And what I mean about the 3 areas is this: there's filling somebody out, getting to know them more, right, and dating. You want to date them. So basically, you want to fill girls out, guys, or get to know a woman more, right, or date them. Well, if you're filling a girl out, and this goes for girls too, they're probably going to be gone in a couple weeks. I mean, they'll probably still be your friend, probably still somebody to talk to, somebody you go out to movies with. But that's all they're going to be, because you're just filling them out. Once you get to that second level, to get to know a girl better, I'm using guys as an example. You don't text the girl and go, I want to get to know you better, right? But let her know why you're texting her. A lot of guys, they don't think about that. They don't think, and a lot of girls are in their head. Does he like me? Doesn't he like me? I don't know. He gave me more attention than the other girls. He bought me a drink. He did this, he did that, or, whatever it is, right? The girls tend to think like that. Not all of them. Generally, they tend to think like that. Guys, we don't really make it clear what we want. But once you get past that filling out stage and you want to get to know that girl better, don't go, I want to get to know you better. Right? Just like I said in the other video, breathe deep and say, what is it that I want to convey? I want to get to know her better, but what exactly is it that I want to say? Right? So if you're saying is I want to take her out to a movie on Saturday night, or I want to go out for drinks on a Saturday night, say it. Just flat out say it. Hey, do you want to get together and get some drinks Saturday night? Hey, I was wondering, in girls, and this is I'm going through the review of the video really quick. In girls, do the same thing. It's not 1980, 1970, it's not 1990s, heck, it's not even 2000, it's 2000 and teens, right? So one girl came out, and I showed this in another video. She came out, and she goes, she came out and asked me, she goes, hey, are you going to ask me out this weekend? I was like, yeah. Girls, sometimes you gotta be aggressive. Sometimes you do. It works. And so basically what I'm trying to say, guys, is if you have a disorder, if you have, don't give yourself self-doubt. That's the main thing. And know that you're a survivor. Yeah, you didn't survive a hurricane. Maybe it wasn't publicized. Maybe it wasn't in the top 10 disorders. But if you recover from a stroke that could have killed you, you got through a surgery, maybe got into an auto accident, and shrapnel went through your body, and you lost some organs, yeah, you're a survivor. If you suffer from bipolar, and you were thinking about offing yourself, suicidal thoughts, you're a survivor. It's just different. Right? Hurricanes come in unexpected, so can depression. You're a survivor too. Just because it's not publicized doesn't mean anything. Now, I'm not bipolar, I'm not speaking for that, but you're still a survivor. And so that's that unspoken strength that you have. You get into an automobile accident. It's that unspoken strength that you have that's not publicized. That's a strength. And if you find somebody that sees that as a strength, make sure they do. Make sure they see that as a strength. You're going to view that as a weakness. Your health disorder, your disorders, whatever it is, physical, mental, emotional, but it's a strength. It's a strength if you survived. If you're watching this video and this brought you to there, you're a survivor. Okay? You are a survivor. And so that's what I want to cover. And also, too, the 3 aspects of filling a girl out, or vice versa, getting to know better, or dating. You have to make it clear, a little bit more clear. I see that's the one eternal struggle. And guys, phenomenal tip. You'll learn more about yourself and more about what type of girls that you want. And it's not all about you. It's certainly about them too. But it's you. So you have to you have to know what you want. And basically what I'm trying to say is, once you go from that, I'm just filling girls out right now, and that's fine if you're just recovering from relationships. I don't advise jumping into another relationship, into another one, to another one. Same thing with the girls. Don't date a guy that just got out of a relationship. It's like dating somebody that just got out of, prison. I mean, it's just, their emotions are all rattled. They just came to reality with their own life or their own self, and so you got to give them time and deal with that. But all that being said, once you go from that filling out stage to I want to get to know, you'll notice something different about yourself. You really will. You just will. You'll find out things about yourself like, you know what? You might go on a date, it might be meaningless. And when I say date, I don't mean dating. I just mean, when I say having relations, I don't mean sexual. I mean, you can just be going out to a movie. You can be just going out for the town for the night and just getting to know each other better. But once you get to that second level of getting to know each other better, what it means is, you can sense some maturity within yourself. You'll notice that your communication is more direct. There's a difference going, you're thinking too much in your head. Just breathe. Just go, what is it that I want to say? What is it that I want to convey? You want to see her on Saturday. Okay. Convey it in some type of way that you want to see her on Saturday. Instead of just filling her out. I don't know, and keep the conversation going and da-da-da-da-da-da-da-da. Okay, if you keep on doing that, she's going to be gone in about 3 weeks. I'm just telling you. She's going to be gone. I mean, you can fill her out all in women. If there's an attractive looking dude, I'm just telling you, the same thing that you see in him, you don't think 10 other girls are going to see in him too? So, same thing with guys. So you really have to, it's going after what you want. And especially with health disorders, even more so. And I say that because, again, with the analogy of, if you just come out and just go, because a lot of people don't know when they have health disorders. They, number one thing that I get asked or anything is dating. Or what about dating? Or in the gym. Because a lot of people that suffer physical traumatic things are underweight. A lot of people. I know there's a great market for weight loss, but for weight gain, you can do that. I mean, you can easily do that. You can easily pack on pounds. But it's just knowing about a way about going to it. So you can't go, I just want to gain weight. I want to gain weight. You got to think, how am I going to gain this weight? Boom. How do I want to get to know what I want to say to this girl? Boom. Just breathe and think what it is that you want. Right? It's not hard. So let's get back to really quick what I was recanting. When you have a physical ailment, or you've gone through physical ailments, stroke, I'm just naming tons of things, car accidents, mental, bipolar, emotional, anxiety, all those types of things, and you don't know how to come out about it, small dosage. Small dosages of it. Okay, small doses. You'd be like, hey, you know what, if you have anxiety, my metabolism's quick, maybe say something like that. And they'll just like, okay, got a quick metabolism. You might say, maybe don't even use metabolism. Say, hey, I get a little nervous during movies, during scary movies I get kind of nervous. And they'll have that mechanism like, okay, he gets nervous during scary movies, okay. But see, the main focus is they got to focus on your personality and your looks. And let's face it, if they're already on a date with you, I don't mean you're dating, just you're going out, they like your looks. They like your personality. That's why they're there. So don't deviate away from that. Don't make it about that girl's rack or that guy's butt. Don't make it about your bipolar or your stroke. Right? You can bring that up later. Let them get to know you, because it's not unfair. It's not unfair. Someone walked up to me and said, I just had seizures. I've had that happen to me actually before. I started laughing. Not because I hate seizures. I played that in the other video. But it's just because it was really odd. And that's all I thought about the whole time. This girl has seizures. Even though she was a good-looking girl and all this type of stuff, blah, 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 that's the first thing she threw at me. Was, my name's this, I have seizures. I'm walking out of my nursing anatomy and physiology class, and I'm walking out, and I'm just like, pre-med, and I'm just like, really? And it was kind of weird, but that wasn't the problem. The problem was the girl kept on calling me all the time. Just calling me. Because she let her insecurities, right, get the best of her. She became too clingy. She held on to every word that I said. Which is a good thing. Because that's a girl that's probably going to treat a guy like gold. But it was just, at the moment, she just had, it encompassed her life. I didn't care if she had a seizure. It was just, it encompassed her life. It's how you deal with it. And that's my whole point. That's my whole point. Your self-doubt, how you deal with it, how it affects you. Okay? Maybe you're not as fast, maybe you're not as strong, but there's ways of going about it. So I'll do it in small dosages. Okay? So if you have like depression, don't come up to a girl and go, I suffer from depression, I'm severely depressed. Because then they're like, when you're drinking alcohol and you're out for drinks, should he be drinking? What medication is he on? You know? Don't make it about that. Make it about having drinks and having a good time. You know, and I don't want anybody mixing medication with alcohol. I'm just saying, is that's what it's going to be about. And she's not going to get to know your personality. And she already likes your personality and likes your looks because she wouldn't be there in the first place. Same with you ladies. Ovarian cancer and all that type of stuff. Some hard stuff you guys have to deal with. And guys, you know, testicular cancer happens, and I don't have it, but I'm just saying, happens between 16 and 35, the most prominent. Did you know that? So, anyway, that's my video. That's my recant. Quick version. No self-doubt. Know your 3 steps. Okay? Know your 3. You know, am I just filling people out? Do I want to get to know the person better? And do I want to date the person? Once you get to this level, trust me, you'll realize what level you were on. Probably you just want to fill people out. When you want to get to know somebody, trust me, you'll find more about yourself than you even knew. And the other person that you want to talk to or date. Because that's probably going to lead to maybe dating. My opinion. So anyway, guys, just want to recant that. Done.